Okay, good afternoon, everyone. Thank you for joining today's webinar. I'm Brendan, I'll be your host today. So before we begin, just a reminder, please keep your mics on mute. Any questions you will have during the meeting, please use the chat box. Just to make you all aware, this webinar is being recorded and we will share this at the end. Please share it with your teams and anyone else who wasn't able to attend. So to kick things off, we have three amazing speakers today who will be sharing their insights on how diagnostic testings can transform community pharmacies. First up, we have Dr. Tosin, Medical Director at Tuli Health. She'll be discussing the latest trends, developments in the healthcare industry, and how community pharmacies can benefit from offering diagnostic tests. Following on, we have Dr. Jawe, CEO at Tuli Health. She will be discussing the challenges and opportunities around diagnostic tests, as well as Tuli's contributions to healthcare innovation. And finally, our last speaker will be Joshua Hill, Chief Scientific Officer at Viva Health Laboratories. He will be sharing an overview of current diagnostic products and the benefit for the pharmacies. So after each presentation, we will have a brief Q&A. So like I mentioned earlier, please use the chat box for any questions you will have, and we will answer at the end. So our first speaker is Dr. Tosin. So over to you.
Hi, welcome everyone. Thank you very much, Brendan. So as Brendan has said, we are focusing on, well, I will be focusing on the impact of diagnostic tests on community pharmacy. So next slide, please. So just a bit of a background on me. I am a GP, so I work in both NHS and private GP sector, and I've had previous experience in both primary and secondary care with a special interest in preventative medicine. And I've also worked within the health tech space as well, which has brought me to Tuli. So next slide, please. Okay, so today I'll be covering developments in the industry and having a look at the healthcare expenditure over the past few years, and also the trends within the diagnostic testing industry, and paying particular attention to the plans the government and NHS England have in place, and then looking at our work in building a phlebotomy course and how that can be utilised with our partner pharmacies. Okay, starting off, so having a look at the healthcare expenditure, and so this is from the UK Health Accounts 2020. So the total healthcare expenditure in the UK in 2020 was £257.6 billion, equating to £3,840 per person. Now, the reason why we're focusing on the 2020 healthcare expenditure is because it has a big focus on preventative care, which is where Tuli focuses as well. So in 2020, there was a dramatic increase in government spending when it came to preventative care, growing by 69% from 2019, which is a huge amount, and accounting for 6.7% of overall government spending within healthcare. So if we can just have a look at the figure 6 on this slide. I know it's a little bit difficult to read, but the dark blue signifies early disease detection programs. And you can see there was a big increase in spending from 2019 to 2020. Now, this is largely accountable due to the COVID-19 pandemic that we did see. However, it's important to point this out because this was really one of the main triggers for the government to start focusing on really looking at preventative care and how this needs to be revolutionised. So what is changing within the NHS and what are the government plans? So as part of the NHS long-term plan, there was actually a commissioned report undertaken to review the NHS diagnostics capacity. So it's an independent report called Diagnostics, Recovery and Renewal, which you can all have a look at in your own time, where they really made recommendations to overhaul the current diagnostic model within the NHS. So in this report, it recommends the need for new diagnostic models where more facilities are created in freestanding locations away from main hospitals, so including on the high street and in retail locations. And in this plan, they refer to them as community diagnostic centres or CDCs. So what is the aim of these changes when it comes to diagnostic services? Well, the aim is to provide quicker and easier access to tests, to improve population health outcomes by diagnosing health conditions earlier, faster, and more accurately, to obviously increase the capacity in the diagnostic service, and then also to improve productivity and efficiency by streamlining the way that we actually provide diagnostic tests. And then lastly, to make it a more personalized experience by actually providing the point of care and point of access in local communities. Now, this is really great because this is everything that we believe at Tuli, and we believe in the need to revolutionize diagnostic testing. And actually, we're actually one step ahead. So this NHS long-term plan, it's a 10-year plan. So it's got a long way to see it actually being realized in actuality. However, we have already established diagnostic tests in the community with our multiple pharmacy partners. And we already have a working and proven framework. We already have the logistics and the technology in place. So why pharmacies? Why are we focusing on partnering with pharmacies? Well, we really believe that pharmacies are the heart of many local communities. And by bringing diagnostic tests to pharmacies, it's a great example of what pharmacies are capable of. So like I said, we believe they're the heart of local communities, but they're also easy, accessible, local and convenient for a lot of people. And we find that many pharmacists and people that work within pharmacies have a good rapport and good relationship with their customers, which is vital when it comes to trust and patient care. And also, pharmacists and other workers in pharmacies have a multitude of capabilities and expertise that makes them ideal and equipped to offer such services. So coming on to our phlebotomy course. So actually one of our main focuses in this diagnostic service is actually equipping our pharmacies to be able to become phlebotomists so they can competently and confidently provide this diagnostic service. So at Tuli, we have built an accredited and certified course to train candidates in the core skills and knowledge necessary to become a competent phlebotomist. Now, the course is created by clinicians and overviewed by a professor and consultant in public health. And who's the course for? So you don't have to have prior experience. The course is ideal for beginners. It's also really great for those with more experience, or for those who are looking for more experience or wishing to improve on their theoretical knowledge, skills, and competence. And why use our in-house phlebotomy course? Why not go elsewhere? Well, like I said, it's devised and taught by some of the best trained clinicians and phlebotomists, but also what we really focus on is providing that ongoing personal follow-up and support, which is really important. So we are really easily contactable. We really believe in community care and collaboration when it comes to working with our pharmacies and also our labs. And we feel like that's what really sets us apart here at Tuli. So that's it from me today. I'm welcome to answer any questions. If no one has any questions now, I'll also be around at the end as well to take any questions.
Thank you, Tosin, for sharing. We will open the floor now for any questions. Please use the chat box and we can get more information out of Tosin.
Like I said, I will be around until the end, so we will hopefully have a few more time if anyone thinks of any questions.
someone said, what are the most common diagnostic tests in community pharmacies?
So from what we, from the work that we have done so far, what we've actually built is a core set of tests. So we believe in really promoting wellness and preventative care when it comes to our users. So we built a core set of standardized tests. So for example, we have a well woman and a well man test. And those tests cover really the basics when it comes to health and someone understanding their health and their body. So everything from looking at someone's liver function, kidney function, looking at their blood sugar levels. So really, that's probably one of our, well, it is one of our main sellers and really what people are often looking for, because what we really want to push is really just taking that step forward and not seeking help when it's too late, actually being proactive when it comes to one's health. And that's the message that we're trying to push. So the wellness man and the wellness woman profiles are very well received.
That's great. Thank you, Tosin. We will now move on. So our second speaker today is Jiawei. Over to you.
Thanks everyone for coming. So this is actually our first ever webinar, and there will be more in the future. So I also thank you, Tosin, for sharing a lot of clinical insights and also the current state of the healthcare. So all I'm going to do is, next slide, please. So actually share some of my own insights on the current state of what it is. Next slide, please. So to start with, I would like to actually share a little bit on the current landscape of the healthcare system. So the current landscape is that we are in an era that everything is changing. And we just came out of the COVID pandemic, and a lot of user behaviors have changed. I myself has changed a lot, and that's really the healthcare system accelerated so much in the last 3 years. So the current landscape is that we are seeing the higher percentage of younger populations, and there's a rising income level, and we are continuously facing the aging population. But on the other side, we've been having growing health awareness. People are being more conscious that health is very important, and it shouldn't be reactive, and it shouldn't be just one-off, but rather we should start taking a more proactive approach and looking after our health and maintaining that health. So, well, what we have seen in the UK, because we have this excellent NHS system, which has served most of us, and we've been a great benefit, receiving the benefits of it. But we're also seeing that, in fact, a lot of the healthcare consumption and uses of it is still quite reactive, which means a lot of young people nowadays don't even know who their GPs are. I myself, I think I'm registered to my GP, but I haven't actually seen my GP for years. I don't even know his or her name. The only time I ever really use my GP's name is when I need to fill in some form, and I need to call them and say, oh, what's my GP? And we have become a bit more using the healthcare services when there's a problem. But what I'm seeing is that there are also young people are taking a more proactive approach and say, okay, how can I actually maximize my performance? How can I actually do it to actually make myself more perform at the peak? And we'll see the attitudes really moving towards more preventative healthcare rather than reactive, which is what Tosin has mentioned, that our best-selling products have been the Ultimate Man and Ultimate Woman, which has been almost like a body check. So you have MOT for your cars, and in fact, why don't you have an MOT for your whole body as well? So healthcare itself is going through rapid and full-scale digital transformation as well. Nowadays, I check my medical records, and same with everyone here, everything on your mobile phone. You book all your appointments there, and you check your schedule there as well. And which means if we don't actually evolve and change with the digital transformation, we'll be left out. But when there are changes, there are also immense amount of opportunities. And when these changes happen, the digital transformation, it has improved the patient outreach and also the health outcome. So the information has increasingly being triaged more effectively to the right people. So, and healthcare professionals. So there has been an increase in the efficiency, and it has been the decrease in cost as well. So we're seeing is that the focus of healthcare is really shifting to not healthcare, but rather to health and well-being. And in the future, there will be more focus on really promoting healthy lifestyles, vitality, wellness, and primary and secondary prevention and early diagnosis. So what does it mean? So health is now more than just healthcare. So along the side of the behavioral and macroeconomic changes we're seeing every day, we must embrace the healthcare 4.0. So where health is more than care. The consumption of healthcare has moved to the forefront, and more data has become readily available. And nowadays, people can easily go onto the website and search for certain healthcare conditions, which of course comes with its own pros and cons. And we often have patients self-diagnose with certain symptoms and say, oh, doesn't mean I have this, doesn't mean I have that. So it's actually our responsibility as healthcare professionals and healthcare companies to help the patient and to get to the most knowledgeable and expert opinions in their area. We're also witnessing that tech giants such as Google, Microsoft, Amazon are collaborating with hospitals and have input massive amount of funding into medtech startups, with their current attention on how AI, machine learning, blockchain, and big data can really help the consumption of healthcare and improve patient outcome. So the traditional business model of really relying on information asymmetry, where it's quite common in a lot of retail-based businesses, where we buy products or services on one hand and sell the products and services at a markup price, may no longer be suitable, because people nowadays can quickly go onto a website and actually price compare, and they even have certain orders and mailed to them and sent to them in the same day with Amazon. So we do need to actually start thinking, what can we do as pharmacies and as pharmacy owners, and also as the modern retailers, is what can we do to overcome these potential competitions. So businesses must also evolve, that businesses must be to become more clever in providing real and tangible values to the end users. So what does it mean for community pharmacies, and where does Tuli play a role? So let's look at some of the threats, advantages, opportunities and challenges faced by community pharmacies. So community pharmacies in the UK are largely independent, and what we have seen, especially in London, are often family run. So everyone knows everyone, and pharmacists have their own community. Everyone meets everyone at parties or shows and sharing insights and knowledges, which is very lovely. But the problem with some of the independent community pharmacies are that they may or may not have the digital capacity and capability, purely because the digital part, the digital development is very costly and it really takes time. And what I'm seeing with a lot of pharmacy owners, they're very good at serving the community and very good at dispensing medication and provide the excellent care possible. But the problem is that the digital transformation is a completely different set of skills, which takes time to learn. And that's something I myself don't even have that capability. So then we're facing, as I mentioned, the threat from the e-commerce giant. And also at the back of the COVID, people are becoming more receptive of mail orders and distance buying. And in a way that people have become lazier, and they no longer want to just walk about 5 minutes to their local pharmacies, but instead they just order on their phone and get it sent to them. So this really poses a very big threat to the traditional brick and mortar pharmacies, which often comes with the overhead costs in rent and staffing. And pharmacies have, but they also come with great opportunities and advantages from the community pharmacies. As Tosin had mentioned, pharmacies have always been at the heart of the community. So at your nearest and favorite fish and chip shop or whatever takeaway, this is your pharmacist. And what I also observed talking to pharmacy owners is that pharmacy owners been serving the end user, the patients, generation, and some have been serving their patients for over 20 years and know them by their names. And there's really that lovely and warm, welcoming atmosphere in community pharmacies. And also, the community pharmacies really add a note for patients and healthcare. On average, a person goes to their pharmacy 8 times more likely than their doctors, and the trust in pharmacists is ranked number 2, just below nurses, and in fact above doctors. And we should really utilize that strength in helping the pharmacies to come into the 21st century. And that's where Tuli comes in. We're helping you to actually embed diagnostic tests into the communities and really onto the high street. And offering diagnostic tests is really not something new for community pharmacies. Really, for decades, community pharmacies have offered a range of in-store services from pregnancy testing, blood pressure checks, and mold inspections, anticoagulants, etc. So what we're doing is just really helping the pharmacy to upskill just a little bit and having the phlebotomy services into the pharmacies as well. So Tuli's role in this revolution. Okay, great. So I have always loved quoting, only the paranoid survive. So that's a quote I use among my team. So we're really in the middle of a strategic inflection point. So what is a strategic inflection point? It's where a time in the life of business when its fundamentals are about to change. That change can mean an opportunity to rise to new heights. So that's where we're coming in and really helping the community pharmacies to rise to new heights. To survive the change, to also thrive in this change, we are helping pharmacies to really transform and revolutionize their offerings and to continue offering the communities real values and services and real values. So we are, as Tosin said, we're equipping pharmacy with the skills and knowledge and most importantly, digital capability to really help the pharmacies to future-proof, to embrace the digital transformation. And what we're offering is a team of technologists, clinicians, and marketing experts, and using a data-based knowledge and offering a turnkey solution for the pharmacies to provide the technical aspect of services, so the pharmacies can really focus on what the pharmacies do best, which is to provide the best customer care and the services for the community. Yeah, so that's everything from me, and I would really welcome any questions and also any insights and comments on how we can all work together and really bring digitize and transform the brick-and-mortar pharmacy.
Jiawei, for sharing this insight with us. We will now open the floor for any questions. Jiawei, so we have a question. How can I promote diagnostic services to patients? Hello, Paul?
Oh, can you hear me now?
I can hear you now, yes.
Oh, cool. No, I was just going to say, regarding like the technology side of things, and knowing pharmacy sort of from, like you say, with that community type pharmacy setting, what's the sort of general appetite for technology in terms of, is it quite a drastic change for them, or how are you sort of managing that and making it sort of, is it step by step, or how are you sort of managing them through that process?
2 questions that's asked from the floor. I'll answer one at a time. I'll answer the first question in the chat first, if that's okay, because about how can I promote diagnostic testing services to patients? So we have been finding that there is a bit of educating the public in knowing that the pharmacies offer diagnostic services. You don't actually need to go to a traditional clinic. You don't have to travel all the way to a clinic to do it. In fact, you can get your phlebotomy done right next door. So that's where we actually come in. We have been providing offline marketing services and support for pharmacies, listing out what we can get. And then a lot of if you can see around in London, we already have over 100 pharmacies with the offline marketing materials there. We've also been helping with the digital asset, where people have been putting on to their Instagram and sharing that actually you can get a test from your local pharmacy. And that's another one. And also a few other cases we have done quite successfully with pharmacy owners is that they know their community the best, and then they know who actually have those needs. So we really work with them and helping them with preparing certain proposals and bids in getting certain contracts to the patients. And there are different ways of really educating the public and letting them know, but the demand is really there. It's really how we actually promote it, actually let them know you can get into the pharmacy. It's really important. And also the second question, what Paul said, is about the technology aspect, where I think the question is more on how that's like being welcomed by the pharmacists. So we've been finding a lot of pharmacy owners are incredibly entrepreneurial and innovative and very commercial. And they're in touch with the market every day and know what's been going on. So we actually get first-hand information, and they are also aware that they need to digital transform. So they want anything that can actually improve the efficiency of working and reduce the cost and reduce their staffing. In fact, every day we receive feedback on how to improve, how to use our pharmacy portal to help them to maximize the efficiency of working. So we actually release our features on a regular basis as well. And then for the pharmacy owners to say, okay, I want that feature, I want certain analytics. They've been welcome all around. And in fact, pharmacies will have certain focus groups as well for really helping us design. So this is the pharmacy portal that we're building is truly built with the pharmacists and really considering their needs and feedback. And then generally speaking, it's quite easy to use. It's really step by step. You just need to log in, and the feedback hasting is very easy to utilize. And then you can manage your tests, manage your patients, and also look into your nearest location, order courier, all in one single interface.
And we have one more question. How can test results that are conducted in pharmacies be integrated into NHS records?
So this is, thanks for the question. It's really a good question. It's really an ongoing quest of really having this whole medical records integration. We've been finding that you get the private medical records at NHS, they're really detached. It's almost like these two systems don't intermingle and don't interchange. But I see that in the future, there will be a better integration. And in fact, this is probably what COVID has done. And one of the opportunities that COVID has actually introduced is because of COVID has caused a lot of private providers to do PCR. And the results and the data information, we were required to submit it to I think it's UKHSA, the UK Health and Safety Agency. So they actually have an API backend, and our team, at least as a successful case study, is that we have integrated our database to the UKHSA database by API for the COVID testing part. So I will foresee that in the future, as part of the digital transformation for NHS, that there will be a better integration and data transfer between the private part and also the NHS. But unfortunately, for now, we're still working on that. But one of the things, though, is that the test results, because we work with labs, which we will hear from Josh later, we only work with accredited and reputable laboratories where the test results can be used by NHS clinics and hospitals.
Thank you, Joey. If we have no more questions, I will now be introducing our final speaker. Josh, over to you.
Perfect. Thank you very much for that. So I'm going to be giving a sort of broad overview of diagnostic products, some of the trends within healthcare and how diagnostics fits into those trends, and some of the benefits they can bring to pharmacies, how they can be utilized within pharmacies. So by way of a quick introduction, my name is Josh Hill. I'm Managing Director for Viva Health Laboratories, as well as Chief Scientific Officer for the Your Doctor Group. I've been working within laboratories for the past decade, mostly within pharma, but in recent years, I've moved into healthcare-related testing. Viva Health Laboratories, we are a diagnostic laboratory based within Windsor. We have a strong capability in terms of our test menu with over 450 tests on offer, which span blood sciences, molecular diagnostics, and nutritional environmental testing. And what that means in layman terms is all of the sort of routine testing that you'd typically get conducted through GPs, we can offer, as well as some quite interesting and novel testing that forms part of this preventative healthcare movement that was discussed earlier in the talk. Given we are one laboratory based in Windsor, we also rely on a network of partnered laboratories, some of which are really quite specialist. And so we've got an array of partner laboratories in the States, in Europe, and in the UK that really bolster our test menu. And as a result, we've got this quite holistic healthcare offering, which means not only can we test the patient's current health, but we can also give some informative diagnosis into their future health. So in recent years, as the previous speakers have mentioned, there's been quite a transformation within healthcare and as a result within diagnostics. And really a lot of that's been galvanized through COVID, with two main sort of contributing factors that have changed how people access healthcare and as a result, diagnostics. The first one is really access. So as you'll all know, being able to visit a GP's was nigh on impossible throughout the pandemic. And indeed, the healthcare system is still trying to keep up with that pent-up demand that was met through COVID. And as a result, many consumers and many patients were looking at different ways they could access healthcare, different ways they could access diagnostics, and started to take a proactive approach into healthcare, reaching out to diagnostic services directly, conducting lateral flow tests at home. And really that's carried forward now through the pandemic and has really changed the market and how they access testing. In addition to that, there's a sort of broader piece about familiarity of healthcare, familiarity of diagnostics, and how that can inform your health. Prior to the pandemic, I'm sure the only familiarity people had with lateral flow tests was probably pregnancy tests, and certainly PCR wasn't really something that was in someone's vernacular. But through that familiarity with diagnostics that people gained, they suddenly understood that they could access healthcare testing. And there was also really unprecedented demand on laboratories for diagnostics. And as a result, UK laboratories built up a huge amount of capability, which is now carried forward beyond the pandemic. And as a result, it's now easier than ever for patients and consumers and clinics to access healthcare and diagnostic testing. One of the other key trends has been this sort of self-service model, whereby patients would go online, order a test, and conduct that test at home. However, there are some pitfalls with that methodology. Often patients are unfamiliar with how to conduct those tests. Often things get lost in the post. And as a result, that can affect the results, the turnaround time, or even the validity of those results. So I think the sort of unique positioning for pharmacies is that it still allows patients to go and have that human face-to-face interaction, to have their blood drawn through traditional means, and ultimately mean that they get the full broad array of tests normally available to GPs. So the takeaway here is really that there is a huge amount of diagnostics available within pharmacy. All of your sort of routine testing that we previously discussed, and whether that takes the form of general health and well-being screens or more specific screens tailored around someone's specific conditions or health risks. The sort of broad takeaway is that all of that can be achieved through pharmacies. And as a result, all of that demand for the variety of testing that consumers now want, and the proactive approach they're taking to the healthcare can really be offered through pharmacies. We've seen a lot of data over the last couple of years that really mirrors what the demand is by patients. And it tends to take the form of these wider, broad, more all-encompassing health screens. As the previous speaker mentioned, They give a great insight into your current health. And if you're going and electing for one of these tests yourself, the likelihood is that you maybe don't have an underlying condition, or you don't know if you have an underlying condition. Instead, you just want a broad sort of overview of your health. And the good news is pharmacies are really well placed to offer those tests. That's it, I think. I'm not sure if I've got another slide on here. Just a Q&A. So, I mean, that gave you a sort of broad overview and snapshot of diagnostics, the capability, and how that fits within pharmacy. I'm happy to ask or answer any questions that you might have. So yeah, please do pop them into the chat and I'd be happy to answer.
Thank you, Josh, for sharing with us today. And yeah, like mentioned, any questions, please use the chat box. Okay, so we've had a question through. What are the most popular tests requested and how quick of turnaround times?
So there's two sort of strands that we see to diagnostic requests. The first are people that are going for sort of elective and preventative healthcare routes. They don't have an underlying condition. They just want a sort of general MOT. And those take the form of these general health and well-being screens that cover a variety of different tests and give a sort of broad picture and overview of your heart function, your kidney function, your liver function, your cholesterol levels, what your risk is of diabetes, etc. And those are particularly popular, particularly within private healthcare. So that's the first sort of form of healthcare related testing. The other that we see quite frequently are more specific tests. So if the patient is aware that they have an underlying condition or they have a chronic condition that they need to monitor, perhaps they have family history of conditions, those packages can be tailored and formed around patients' needs. The good thing about VHL, or how we're trying to position ourselves, is that practitioners, pharmacies, people that are raising requests can form their own bespoke and specific packages to meet their patients' needs. So we could work, as we work quite closely with Tuli, we've helped, we're helping to develop a package of tests that give a really broad scope, as well as some quite specific tests that meet patients' needs. And then in terms of turnaround times, within our laboratory, we conduct most of the testing, 95% of those tests by volume in-house. And we're quite proud to say that we offer on average a 4-hour turnaround time. One of the interesting things that we developed through our time within COVID testing was the fact that the market really needed tests and test results delivered in exceptionally quick turnaround times. So we've ensured that we've carried across those service levels into what we're offering now.
That's great. Thank you, Josh. Just give everyone one more minute to get any last final questions in. Oh, we just had another question through. What's the most popular test in VHL?
An interesting question, actually. So broadly speaking, the testing that we conduct in-house is by far and away our most popular form of testing. So that's blood sciences, that's your routine testing. But we have quite a unique position with some of the more proprietary testing that we offer. We're the only lab in the UK to offer a SIBO diagnostic test, which diagnoses small intestinal bacterial overgrowth, which is by far and away the largest contributor to IBS. So a test that really applies to millions of people within the UK. And that is by far and away our most popular test, which is good, given that we're unique in being able to offer that. But as I've said, with the broad array of tests that we have available on offer, we can be sure to meet the market's needs in terms of what they're looking for.
Oh, now we've got some more questions coming through. Is the SIBO testing something that patients can do easily?
Yeah, so it's a non-invasive test. It has quite a unique method of sample collection in that we collect patients' breath. So it is very easy to use in terms of specimen collection, which is probably part of the reason we've seen it be so popular. You know, patients are familiar with taking blood, but certainly some patients are squeamish about it. So yeah.
Okay, I'll just give everyone one last minute to get any questions. Okay, perfect. I won't leave Josh waiting too long. So that will conclude our presentations today. I'd like to thank all our three speakers and for their insights and information that they provided with us today. Hopefully that the takeaway will give you a better understanding of the opportunities that these services can be for your business. As a token of our appreciation for your attendance, we would like to offer you a special discount on these services and opportunity to win a free ticket to the upcoming Clinical Pharmacy Congress next month at Excel London. We are finishing up. Following today's webinar, we will send you an email with the relevant information and resources discussed today. If you have any further questions or feedback about this event, feel free to get in touch with us. And lastly, also we'd love for you to share your thoughts and feedback about this webinar on your social media channels. Don't forget to tag us using the hashtag Tuli webinar. We'd be thrilled to hear from you and continue the conversation. Thank you everyone for joining, for taking this time out of your busy schedules. Let's see. Yes, thank you everyone. And we'll be now closing this webinar. Hopefully everyone has a great afternoon and a great bank holiday. Thank you.